Rabies is one of the very few infectious diseases with a nearly 100% fatality rate once symptoms begin. But what makes this virus so deadly? Rabies is a neurotropic RNA virus belonging to the Rhabdoviridae family. Unlike airborne viruses such as influenza, rabies spreads primarily through the saliva of infected animals. This transmission usually occurs through a direct bite. Most human infections occur after bites from infected animals. In many regions of the world, domestic dogs remain the primary source of transmission. Once the virus enters the tissue through the break in the skin, it begins its journey toward the nervous system. After entering the body, the virus initially replicates near the wound. It partially hides from the immune system during this phase. It then travels slowly through peripheral nerves toward the brain. Moving at just millimeters a day, it remains invisible to our defenses. Slowly but surely, it reaches the spinal cord. Once rabies reaches the central nervous system, severe brain inflammation develops. This condition, called encephalitis, causes rapid neurological deterioration. The brain begins to lose control over vital functions. Early symptoms may resemble common viral illness, including fever and weakness, but later stages can cause hydrophobia and confusion. Patients experience hallucinations and profound paralysis. Eventually, it leads to respiratory failure. Without intervention, death is inevitable within days. Rabies is exceptionally lethal because once symptoms begin, extensive neurological damage has already occurred. At this stage, survival becomes extremely rare. The window for treatment has slammed shut. Fortunately, rabies can still be prevented after exposure. Immediate wound cleaning is the first critical step. Rabies immune globulin and post-exposure vaccination follow. These can stop the virus before it reaches the brain. This protocol is known as post-exposure prophylaxis. According to the World Health Organization, rabies still causes thousands of deaths annually, especially in regions with limited vaccination access and inadequate animal control programs. Rabies demonstrates how a microscopic virus can exploit the nervous system. Yet it also proves that timely vaccination can prevent it. Public health intervention is the key to stopping this threat. It remains one of the deadliest, yet most preventable diseases known to medicine.